our company try to improve the healthcare standard. They can choose by themselves which one is fit for them. Cost management is okay, but you need to keep the standard too.
Gender reassignment surgery.
This is a sensitive issue.
Sure.
Some people may be against it, but it's a way of life. Our job is just provide clear information about the thing that you need to do. Healthcare have good and bad way too. So this is my job to identify which one is the best for the customer.
Welcome to the Tiger Podcast. In today's episode, we'll be discussing the growing world of medical tourism in Thailand and introducing Allied Health Thailand. We'll be joined by Dr. Chokchai, who will walk us through their approach to patient care and the innovative services they provide. Stay tuned for valuable insights into how Thailand is shaping the future of healthcare for international patients. Thank you for joining us. Now, you're here with Allied Health Thailand, right?
Yes.
Could you give us an
I will
introduction?
introduce about this company.
Please.
Actually, I work this job as a hospital advisor for a period of time. At that time, I have a chance to meet many people, and they suffer from other condition. So that means they seek medical treatment or investigation. At that time, I volunteer to advise them to find the best one of the healthcare provider in Thailand. So this is a turn to the business. That means I set up this company roughly around 2 or 3 years ago with the existing way of working. That means I still do the same, but more professional. So our company try to seek the standard healthcare in Thailand. Service facility, the professional of the doctor, the standard of the hospital, including the cost of the treatment, each part or each condition that the customer suffer or seek medical treatment here in Thailand, and ranking all the service healthcare and let the customer choose by themselves. That's all.
So you're creating you're creating a way for customers, for patients to be able to pick the right partners for whatever they need.
It's be the same as a medical tourist company, other tourist company, but they have a strength because of most of the company derive from the translator. Our company a little bit different because of we provide the medical opinion, second medical opinion for them first to check about the planning of the investigation or the treatment and let them know what is the best for them.
Right. So I think what's something that sets you apart, many of the other medical tourism companies, right, they don't actually have the medical experts on staff, right? They're just trying to create a relationship, maybe not take so much care in the patient and just move people along, get the money flowing. But you have this medical expertise that you bring to the table.
Yes. Our company try to get the way of the operation, try to improve the healthcare standard and the standard of the medical tourism for sustainable. That means we provide academic or education for the customer first and let them know which one is the best for them. By select which one is the doctor is the best, which hospital that is standard, local standard, international standard, or APAC standard, or service facility in each hospital. As you know, the last one is the cost. That means they can choose by themselves which one is fit for them. Because of we don't know exactly they have some issue or not about a thing inside his mind, their mind.
Right. And costs are obviously a big part of this business. People don't want to, go bankrupt or end in debt, like for some medical treatments. Maybe some medical treatments they don't need, right?
Yes.
That is a very important part of your job, to match the patient with the right care that they are looking for.
Yes.
Well, that's a wonderful introduction to Allied Health Thailand. Can I ask you, Dr. Chokchai, about your own background?
Okay. Actually, in the past, I'm a soldier.
Oh, really?
Yes. Including serve in the army hospital, roughly around 20 years, and heart surgeon by train.
Oh. So did you get your education while you were in the military?
No. Yes. In the military. And after that, I went to Fort Navamin Hospital, close to the Bangkok at Chonburi province. Set up heart center over there for province hospital, and have a chance to set up many heart center all over Thailand.
So that's wonderful. You're able to bring your expertise and maybe more access to healthcare to places. Obviously, Bangkok has many, many hospitals, but Thailand has many people in rural areas that maybe don't have access to that quality of healthcare.
Yes.
So that was your background then. So
and after that, I voluntarily retired from the army, and joined with the biggest group of the hospital in Thailand. At that time, I have a chance to be a part of the admin team to set up the new hospital. That's mean I'm traveling a lot all over the country, Cambodia, Laos, or Myanmar. Or sometimes maybe went to Addis Ababa.
Oh, really? Ethiopia too.
Yes. Because in part of the marketing. The first, after join with the private sector, and have a position of the executive physician for marketing management of the hospital, deputy director of the hospital, and finally have a hospital advisor before retire.
You sound busy.
Probably around 20 years joined with the private sector. Yes.
So,
but fun.
It's a good job then. You enjoyed doing it, right? Can I ask you, which did you like more, the work you did in the army or the work that you did afterwards in the private sector?
A little bit difference because of in the army don't concern much about the efficiency of the staff, of the people that they have. So it's run routinely, something like that. But in the private sector, after joining that, my boss already passed away. He's a great heart surgeon in the world. They told me, don't turn off the cell phone because of someone need your help, so that you need to available. In the private sector, they have a highly standard. It's an opportunity. It's good luck for me to join that because of learn a lot about the standard of the treatment, service facility. Standard that's mean we have two parts: medical standard and service standard from other people that we need to collaborate and serve for the customer. That's learned from me a lot.
So yeah, there's obviously the medical world is always changing. There's new methods, new processes, new efficiencies, and say administration, things like that. So I think it's interesting that you're a part of that and trying to make a better outcome and better results.
Yes,
not just for the treatment, but maybe also for the costs too, making it easier for people to afford these kinds of services. So how did you end up joining Allied Health Thailand then?
As I told you before, when the position of private sector as a hospital advisor, I have a chance to help many friends, many people find the best healthcare for them, for their situation problem that they have, that they face. So that is the part that we work until retire from the private sector at that sector, that group. So I set my own business at the same way. Yes.
So just step by step over here,
Yes.
right?
But right now I have some three positioning. First, to be the surgeon. Still be the surgeon. Still to operate.
Still?
Yes.
Wow.
Secondly, at admin. I'm in the part of the executive director of heart center in another chain. Try to improve the way of the operation, the way of the treatment as a standard, international standard, and follow up, monitor outcome of the operation.
What have you seen any challenges as you've tried to elevate the standard of medical care?
Yes. Many standard first is depend on culture of the organization. Some organization have academic oriented organization. It's okay. It's very good. But some organization focus on cost effectively more than standard. That's
Cutting
all.
costs, right?
Yes.
Yeah, that's.
Yes.
I mean, it's
Cost focus.
yeah, but it's a big part of the game. If there isn't money being made,
Yes.
then you can't.
But we need to
stay open.
balance.
Yeah.
Cost management is okay. It's good. But you need to keep the standard too. This is the reason why our company try to set the standard of the provider and give the customer the academic or the knowledge and how to manage their own.
Now, when you talk about increasing or making a very high standard of care here in Thailand, what does that mean? How do you bring? Are you bringing international standards?
Right.
What are the challenges?
The challenge part of the it's good luck for me because I know many chain of the hospital in Thailand. That means we know well about the standard of each hospital. Some hospital have some local standard, hospital accreditation or something like that, or some hospital have APEC standard, and some hospital have JCI. That means this is a standard of the hospital or healthcare, and we qualify the standard of the professional by the age, local train or international train or international certificate, something like that, and list for the customer. That's all.
So you basically give the customer options, then, right? Like
Right,
you're trying to.
right.
So
But the more difficult part is let them know about our standard of the operation, because of some patient like comment about, Thailand is very good, but they have experience about the service not so good. This is the reason why we need to set up the company, because of if you walk like in the hospital that you don't know anything about that, you may face about a high standard or medium standard or the lower standard. Nobody know.
right. So by you acting as a partner, you put your name on the line, right? Your reputation is there, so that makes that can build trust with the customers that you work with. So what is the process like? How do you guys, like, if say I'm a medical tourist and I want to come and work with you guys, maybe just for general health wellness checkups, something like that. How does that process work when
Normally the
customer comes to
process
you?
is we have many social media, such as Facebook, such as WhatsApp, such as a website. After the customer contact with many way, we let them or introduce them to registration in the website first, because of we need to verify which one is the customer, because of when we open, nobody know who come. That means we need to find out exactly customer that need help. That's all. After registration, so what's the problem? The suffer, such as the need dental checkup or dental treatment or aesthetic surgery. That is a most important part in Thailand.
There's plenty of people coming here for cosmetics and things like that, right?
Yes.
It's very
Especially in
popular.
the Australian people.
Oh, really? Australians are coming through, especially. Well, the cost of cosmetic surgeries in Western countries seems to be very high, so that creates an incentive to come out here to Thailand, where there's very high quality without breaking the bank, so to speak. Yeah. So
especially in Australia, the cost of the treatment for the dental checkup or treatment is very, very high.
No, I've lived in Australia, so I know firsthand.
Okay.
I've had to deal with.
Surprisingly, when you came here by appointment, you can treat everything maybe within 7 days.
Yeah, so quick. Plus you get a trip to Thailand too. Isn't that wonderful?
Yes.
I love that. Land of smiles. Well, now you say this is Allied Health Thailand is a doctor-led organization. How does that separate you from other medical tourist companies then?
Yes, that is important part because we try to provide the academic or the knowledge for the customer first. We don't want to bring the customer to the hospital that only know. We need to know, you need to know, or the customer need to know this is a way of the treatment or not. This is a way of the investigation. They need to know, they need to have the information about the efficiency, the effectiveness of the treatment too. Success rate, possible complication, length of the stay in the Thailand or in hospital.
So it's almost like a built-in second opinion then, right?
Right, right. So and for free.
There you go.
Yes,
that's part of the service.
Yes.
Why do you think it's so important to seek a second opinion when undergoing these medical procedures?
Normally, we have many way of the treatment. It's depend on the information that we have. First. Secondly, we make sure that the way of the treatment that they know in their mind is right or wrong, or they have another kind of the treatment for the same condition. Because of in the condition, they have many way of the treatment. It's depend on many factors.
Yeah, I might have something in my neck, actually. You might need to look at me later. But that's the thing. So different conditions, there are different treatment methods, right? For that, but also, you guys offer all sorts of crazy services. There's, from surgeries to even wellness retreats, right? So can you talk a little bit more about what do your customers come to you for? What are they looking for when they seek out your services?
Mostly they came for the aesthetic surgery, such as facelift, nose adjustment, or something like that. First, mostly, and secondly is a dental checkup. Some part have suffer from another medical condition that need to treat here. It's possible. For example, one of the customer came from another country because of the neck problem. Some disc protrude and compress the cord. So we advise him to do the operation. This is for sure. Because of some weakness of the muscle of the arm, of the leg already. So that's when we need to remove the cause of the compression. Provide the small operation, small wound to remove the disc that compress the cord. That's all.
So it ranges from everything.
Yes.
So when we talk about, you say dental services are very popular as well. What does that mean? Are people coming just for regular checkups, or are they coming for?
Maybe the regular checkup is possible, but most of the people came because of need to implant the processes.
So like missing like veneers or something like that.
Right. The veneer.
Those are so popular these days. I see so many celebrities just all with the same smile now. But it's just it's a very popular surgery, or procedure, not surgery, I guess.
Surprisingly, one of our allied company, they can do what we call upper and lower part of the implantation in the same day.
Wow. So just in and out.
Yes.
Like that. You can get chomping very quickly. I love it. Well, you have a history your background is in heart health. So how do you have people coming through for cardiac surgeries, for more serious surgeries?
We have. You need to know first, roughly around 70% of the customer of the heart disease condition don't have any symptom at all.
Yeah.
Uh-huh.
Scary.
The chest pain radiate to the arm, to the jaw, or the arm may be typical picture of the heart disease, heart problem. But for me, in important way is the early detection. That's when we need to screen for check up the heart condition first. Right now, they have many way of the investigation that less invasive compared with the past. It's much better and outcome is more accurate than the past.
So
Sometimes they don't need to stay in the hospital at all. Just come and go. It's only one way.
well, so
check.
yeah, what is the process now? How is it better?
Normally, we have check history first. Secondly, maybe draw the blood for check many tests and echocardiography or ultrasound the heart, stress test. Finally, some people need what we call the study of the blood vessel to supply the heart. In the past, we need to use a puncture in the arm or the groin, put the what we call the stent in to find out or inject the contrast media. That's scary. But right now, we have the X-ray computer is very, very sensitive and more accurate. So that's when we come and go do the X-ray computer. It will generate the picture of the heart vessel. It's very cool.
Less invasive, more accurate. That sounds like a win-win to me. It's something that's very important to me too. It's it's a big thing in America, right? Leading cause of death over there, and it's affected my family too. So it interests me, and I'm very glad that you're doing this kind of work. Now, I also want to talk about something that's very popular in Thailand, actually, gender reassignment surgeries.
Yes. This is a sensitive issue.
Sure.
Some people may be against this, but it's a way of life. So if you need to have this procedure, we need to know many things. First, psychological support. Surely, accurately need or not. Secondly, you need to advise, consult the endocrinologist, advice about the hormone therapy, hormone treatment.
HRT, right?
Right. Thirdly, the surgery is many method to check. What we call reassignment. Right. Upper and lower. Some guys maybe adjust or change the upper part first, lower later. It's possible.
Yeah,
And the kind of the treatment is very, very complex. But if you're sure, you need to have and confirm by the psychologist already. So that means we need to go in the process. And before that time, roughly around 20 years ago, this kind of the sex reassignment need a period of time, long period of time, roughly around 12 or 14 hours of the operation.
Wow.
But right now, this technique is very improved, short from 12 to 4 hours. And the sensation of the organ still be the same.
So
it's very good.
You're not losing as much as you used to then. That's
Yes,
very interesting.
Yes.
And it's good to hear that there is such a strict process on this to make sure that the psychology is proper.
Yes.
The person has the right support that they need for this, but also, hey, it's an option because I have friends that have undergone the surgery. I have friends that have done HRT but not done the surgery as well. I mean, there's a million answers for a million different people with a million different questions.
This is a medical way of the treatment because of we treat the customer, the people. That's different people by people. So no standard for all.
That's a beautiful personalized approach that makes people feel like they're getting the right kind of the respect and this is a big deal. It's a big decision, so it's important to understand all of the factors that go into making this decision. Well, it's great that you offer that service, especially because, many neighboring countries to Thailand don't really even have this conversation. So I think it's very important as the world moves.
Sometimes
and the
just
culture
only
moves.
mention about the LGBTQ plus or something like that. They're against you.
Yeah. No, it's something I've seen it in the politics back home. It's something I always thought was very interesting about Thailand was that, there are aspects like gay marriage maybe is coming soon to Thailand. But this whole transgender issue, it's always been a part of Thai culture, I think, historically.
They always welcome everybody, every people. They don't concern much about the way of life, or the section, or what we call sex privilege.
Yeah. That's I mean, it's a very open society.
Yes,
that's for sure.
yeah.
And that's why so many people love to come to Thailand. And I know that's one of the reasons I do. I think it's a wonderful place to be, seeing such an open, accepting society.
One of my customer contact from Middle East country. Surprisingly, because the Middle East is some religion that against that.
Yeah. Actually, I've heard some interesting stories about there. In Iran, actually, there's places that do a lot of gender reassignment surgeries over there, because that is seen as acceptable compared to homosexuality, just being gay. So very complicated still in the world. And I think this is a place where Thailand is a leader and can provide an example for other countries, especially when it comes to the medical, the very important science that comes with this territory, not just the culture.
One of my partners stayed in Phuket, the tourist destination area, sand and sea, and the way of treatment like this is more interesting.
Yeah, it sounds. I love being by the beach. That's so nice. So that actually takes me to my next question. So you say you're a one-stop service medical tourism agency. So what do you have in place to assist patients coming from other countries, and what other services do you provide besides just connecting them with the care that they need, but on the actual tourism side of the medical tourism?
Normally, we have many partners, not only the healthcare provider, but the tourist company or the hotel too. So we can arrange everything for the customer. Just only know first you exactly need. Secondly, you intend to come here, and about exactly date. After confirm that, we will arrange everything for you.
So that's from transportation to the hotel stay.
Yes.
How about activities? Like, can you provide recommendations?
On after treatment, like such as a sex reassignment, you need to stay in the hospital or in the hotel for a period of time. And activity that need to looking by the professional to make sure that everything that they done is good for you.
Observation time, right?
Right,
to make sure it stays the way it's supposed to. But people do come to Thailand. It's an interesting offer, right? You can come to Thailand for these medical services, but then also you can enjoy some of Thailand too.
Yes.
Many people are always interested to come. What does it look like then, the treatment process? So you start from consultation, you ask them these questions, right? How does the process proceed from there? Like they talk with you first and then you connect them with their treatment plan?
Normally, the medical tourist agency, they collect all information of the customer and send to the hospital. The hospital will provide the way of the investigation or the treatment and roughly about length of stay in the hospital. And they will send this information to the financial department to estimate the cost. And after that, they will send those information to the tourist company. The tourist company communicate to the customer. But we difference because of if you have some initial information about healthcare and you need, we will provide the way of the treatment. the hospital or the healthcare just only estimate the cost. So that's when we short operation. And after that, if you decide to come here, we will arrange everything that you need to know.
One-stop shopping, right? Like just easy.
And it's more easy, much shorter.
Where are most of your customers coming from these days? Yeah.
Initially, we focus on CLMV country.
What's that?
Cambodia, Laos, Myanmar, and Vietnam. Initially. And after the end of the year, 50% of the customer are Thai.
Oh, really?
That stay in Thailand too.
It's just locals, huh? That's
yes, local people.
Wow.
But after open the company, they came from many countries. Australia, Indonesia, Pakistan, things like that.
Wow.
Because of no boundary.
Right. Yeah. I mean, it can come from. It's all you need is an airplane to get here. Why were you originally focusing on the CMLV countries? What was the
in the first part? Because of the familiar. I'm familiar with those countries first, and start the operation and test the operation for those countries.
And I imagine Thailand probably has a more developed system than these neighboring countries.
In CLMV country, have what we call is be the same of the customer that they don't trust in the healthcare professional, the doctor or the nurse. So that means they always seek Thai physician, Thai nurse.
Yeah, Thailand is, when we talk about the ASEAN region, right? Thailand is really probably the leader, one of the most developed economies in the area, and with that comes a more developed medical system too. And like you said, though, there's different levels of treatment, right? Some of the private hospitals are able to offer more international standard, right? That kind of thing.
Some hospital is a local standard, something like that.
Local standard's still good, though, right?
Who knows?
Yeah.
If you came from abroad, you don't know which hospital have which standard.
Right. Yeah, so it's just a name, right? Like, so all you see is a name, and you don't know what the quality of care is going to be like. Yeah, so that's your job. You have to provide the information and let people know exactly what they're getting into. That's great. Now, Allied Health, you guys say that you provide customer support 24/7.
Right.
So how does that work? Are you just like waiting by the phone?
We have two ways. First, after confirm the customer already, they can communicate with many channels. Sometimes maybe by WhatsApp, email, or something like that. So we already serve you. But mostly of the people, of the customer, come from abroad. They don't mostly know emergency treatment. So they have a time. So we 24/7 service, but the turnaround time may be 24 or 48 hours for complete information.
Okay, cool. So it takes a dialogue, right? It takes some time to, I think it's so nice that there's so many different channels to access now. Like I think before, just be a phone call, something like that. Maybe wait for the phone call back. WhatsApp, emails, websites, plenty of options. That's nice. Well, what about the actual facilities provided by Allied Health Thailand? Where do people stay? Where are they usually? Who are your partners? I guess we could ask.
As I told you before, we have many part of the partner. First part is healthcare. Second part is a wellness. The hotel, the resort, long stay. We have one of the partner. They have two location of the resort for long stay in Chiang Mai. You already know that in Chiang Mai some season have pollution. They built the facility to be the positive pressure ventilation. That means the pollution cannot enter that building. But if the patient don't want to stay there, they have another location in Phangan, near Got Samui.
Oh,
It's very good.
oh, I've been there.
And yes, especially in time of the full moon party, right?
Oh, yeah.
Yes.
I don't know if I think my full moon parties are behind me at this point, but it is nice. There's so many wellness retreats, so many. It's such a great, backdrop and environment, especially when you're pursuing these medical treatments and these kinds of things. I want to ask, what are some other kinds of services? Now, you said the most popular is
Yes.
the cosmetics, dental.
And,
What are some
sometimes
weird?
we have
things?
some
Yeah.
alternative treatment too by using stem cell or something like that.
Ooh, yeah.
We have a partner of one of the high standard company, high standard accredited already from the lab or everything and to use stem cell.
So, is that increasing in popularity? I mean,
Yes.
I've heard so much about it lately. How does that work if you're going for the stem cells? What does it treat?
In theory, if you inject stem cell to any location of your body, it will be growth to be that organ. In the past 20 years ago, I joined with a project that tried to inject the stem cell direct to the heart muscle because of the heart muscle not strong or weak because of lack of the blood supply. Direct injection of the stem cell to the heart muscle, it generates to be the microvascular and the heart muscle. So improve the heart function. It's be the same.
Wow.
Right now, some doctor inject to the scalp to increase the hair
growth.
Right. Inject to the face to be the younger. Inject to the knee for the prevent degeneration.
So
like that.
It
But
seems
this is alternative.
right.
It get along with the standard treatment too.
Do have there been a lot of success stories? Do the patients that undergo this treatment, are they very happy with it?
They are always happy. Are happy because of the satisfied of the outcome of the treatment.
It's pretty
But
crazy.
first, they need to know exactly which is standard, and this is a alternative of the treatment. If you combine, it will be good for you.
So you use them in
Combination.
right, in combination with each other. So what do you mean by that then? So let's say, all right, I have a knee problem, and I want to go through the stem cell treatment. How does that work with other standard treatments? What else would I be doing?
The way to use the stem cell theoretically is very good, but in the modern medicine, they trust on evidence base. The stem cell treatment is still need the long-term result. So the important part of the stem cell usage is the standard of the way to grow, of the way to collect is much better. And after that, you decide by himself.
I guess we all have to make our own decisions then sometimes.
Right. Because our job is just provide clear information about the thing that you need to do for your condition.
So you provide people with the knowledge and empower them to make their own decisions in a proper
I think
way.
this is a way of the work is more sustainable for the business more than financially.
Yeah, I mean, if you have satisfied customers, then you have word of mouth and you have more people coming back too.
Yes.
So that's
But
wonderful.
need a little bit of time.
Sure, yeah. Just like any business, it does. You're not going to be rolling in the money at first, but it does take time to build the trust and the relationships, especially with something so that people take so seriously as their health.
Yes.
It's not like, I'm just deciding what food I want to eat today, something like that, or what movie I want to see. It's a very important life-altering decision.
Yes.
So it's great that you take it so seriously and that the customers are happy with it. I wanted to ask quickly about other aspects of health, maybe say, for example, mental health. Are there any services that you provide in that way or say like drug rehabilitation or something like that? This is
Yes.
it's a big
for the
problem.
example,
Yeah.
I have a contact from one of the customer that their daughter in Singapore have psychological problem and need to admit in the hospital and need to transfer here to Thailand for the treatment. Because of it there, nobody take care of her. So our services arrange about the transportation, the customer, the patient from Singapore to Thailand and admit in the hospital to evaluate and treat. This is a little bit complex.
I mean, it's a big problem. I've lived in China before. I was a teacher in China before, so I was dealing with high school students that had, always high school students. Yeah, it's a very, very high stress situation. Also dealing with there were learning disabilities that were undiagnosed.
Yes,
there were all sorts of mental problems that were just swept under the rug. They were ignored because there's just no conception of it. People don't think about it. And I think it's probably true of a lot of Asia that there's not treatment of mental health issues until maybe it's too late or something bad happens.
Actually, our allied health company may be more easy in two parts. First part is medical tourism. Second, that does include all scope of the service of healthcare. And another part is wellness tourism agency. That means we arrange to prevent, to early check about the condition, your healthy condition, and how you stay with long period of time with a good looking shape, that good mental, something like that. To be two part. This part have some. The customer suffer from some condition, but this part, the patient or the customer don't have any suffering condition at all. So that means sick, the way of life, the good, cool lifestyle of living, something like that.
Yeah, so the diagnosis is very important, right? Like, what is the root cause of the problems? And how can we address those? Especially with, of course, diet, exercise. Not only that, but, are you drinking too much? Are you...
I mean, we need to, the middle way. Drink is okay.
Sure.
But not too much.
Right. Of course, moderation, we say. All things in moderation. But no, I'm glad to hear that you have these kinds of options for people that are suffering from not really medical health issues, but maybe mental health issues as well. Well, I want to ask you, what are some, have you dealt with any funny cases, like any interesting cases that people maybe had unique challenges and you had to come up with funny solutions?
Normally, mostly it's straightforward. It's very good. Transfer the customer from Singapore for the mental problem. Transfer the customer from China because of heart problem. Transfer the customer from Cambodia because of what we call spine problem. Another customer from Cambodia too because of the heart, not heart, mass in the chest. I need to remove it.
Wow. So you can...
And we try to use the way that we call value-based healthcare. That means try to collaborate with many healthcare. That means try to improve all the standards, such as we transfer the patient, the customer from the Cambodia to Bangkok. After treatment, sometimes we use the telemetry to follow up the customer at the hospital in Cambodia with the hospital in Bangkok. So that means we can improve the collaboration. The customer may be safe because of don't need to buy the ticket to come to Thailand every time that you follow up.
So you can keep open the lines of communication so that everybody understands the patient in a holistic way, rather than, okay, show up, tell me your history. Now you have the documents to go with the patient as well. That's very good, I think. I'll ask you just a couple more questions. What do you see Are there any like dangerous maybe aspects of the medical industry right now? Say maybe some scams or some procedures or bad actors in the industry.
You may surprisingly, healthcare have good and bad way too.
Mm-hmm.
So this is my job to identify which one is the best or situation for the customer.
Mm-hmm.
Try to avoid the what we call abuse of the treatment that go to the wrong way for the customer. We try to evaluate, analyze. That is our job. Try to identify which one is good, which one is moderate, which one is best, something like that. This is a way of the business. I think the bad part of the healthcare provider may be reduce.
So how do you identify those bad actors? How do you identify the people? What do you look for, I guess, when you say abuse?
Back to the thing that I said to you before. We try to identify the professionalism of the customer, of the doctor, the profit and the standard of the hospital, service facility. This is only way that we can do. Because of some doctor just only graduate from the medical school, but no specialist or no train in some part of the treatment. In Thai regulation, when you graduate from the medical school, they can do anything. But good or bad is depend on experience, training, and everything. So we try to identify that.
So make sure that they have the right experience for whatever ailment, whatever treatment they need to be administering.
Right.
So, for example, the heart surgeon maybe shouldn't be doing the brain surgery, something like that.
Yes.
So everybody has their areas of expertise, and you find the right partners for that.
Yes.
That's is that difficult? Like, is it a challenge for you, or do you find that everyone is very professional
When
here?
you work in this medical professional for 40 years or 50 years, it's not so difficult.
You know what to look for.
Yes.
Yeah.
Yes.
And that's what you bring to the table with Allied Health. That's I think a lot of people see Thailand as a place where they can come and get high quality treatment without very high costs. But what am I looking for, right? I don't know exactly how to find exactly the right place to do it. So, how do you feel? Are you enjoying this aspect, this phase of your life, and helping connect people with their health solutions?
I love this kind of the job. Connect to many people, help them, try to find the best for them. That's all.
Satisfying, right?
Yes.
I love it. Well, thank you so much for joining us today, Dr. Chokchai. It was a wonderful conversation. I've learned a lot, and I might be seeing you soon.
Okay.
As I'm getting older,
see me out of the hospital.
Yeah, well, it might be time for a little bit of moderation in the beers, but yeah.
Okay.
But thank you so much for joining us. It was a wonderful conversation. I learned a lot, and I hope our viewers did too.
Nice to meet you too.
Likewise. Everybody, check out Allied Health Thailand, especially if you are out of the country. This is a wonderful service. They'll be able to bring you expertise and the information that you need to make the right decisions about your health. So you'll see all of the links.
Don't hesitate to contact us. That's all. Because of this free service.
Right. You can get quotes. Just get the information that you need before you make any big decisions. That's for sure.
Yes.
Well, thank you so much, Dr. Chokchai.
Okay.
And we will. I'll see you again shortly.
Okay.
Thank you, everybody.
Bye.
Bye-bye.